Valerie Dangler. Valerie graduated from Northern Arizona University, NAU. I think those are the Lumberjacks. I'm close, I'm sure, with a Bachelor of Science, and she also received an AAS degree in dental hygiene from Rio Salado College. She holds a laser certification from the Academy of Laser Dentistry. Valerie has spent the last 25 years in the dental industry, having served as a dental assistant, office manager, RDH, hygiene educator, regional operations manager, a director of hygiene, and practice management consultant. I think, Valerie, you have filled every slot in the practice except for dentist.
In research.
Yes, terrific background for tonight's presentation. Valerie is a proud recipient of the Ufridi Golden Scalar Award, and she's also an active member of the American Dental Hygienists Association. Valerie is on faculty at Align Technology, is a KOL for the Dental Hygiene Coding Committee, and has recently joined Biolase as Director of Hygiene. We are very, very happy to have Valerie with us, and Valerie, please take it away.
Thank you so much, David. Well, good evening, everybody. Thank you for joining us on tonight's webinar. I'm excited to spend the next hour with you, learning a little bit more about you. Again, this is an introduction to diode lasers. So, and I'm very excited to see where you're at in your laser journey. And so I'll have some polling questions for us here. If you want to go ahead and get that going, you can go ahead and just take your phone, and everyone's probably familiar with QR codes by this point. We're using this in restaurants since COVID. So if you just go ahead and take your phone over the screen, it'll pull up. It may ask you to accept cookies. You have to say yes. And then you can just put your name in there, initials, whatever you want to do there. Hit continue. And then it's going to ask a question. So while you guys are doing that, again, I'll just give a little bit more of my background. David already went through everything here. Again, I love lasers, and that's why I'm here today to share my history and some best practices with you, and why I believe lasers are the standard of care for us. So as we go through here today, the one thing that we didn't importantly touch on is, yes, I'm a boy mom. So those are my three sons there, Joey, Nicholas, and Gianni, and they're back in Atlanta, Georgia. All right, so I'm coming to you from California today. And so those of you that are on the East Coast, thank you for bearing with me today. I know it's late over there and you've had a long day. All right, so let's get going. I'd like to see how, what city are you guys from? Okay, looks like we've got Louisville, Phoenix, Kalamazoo, Smyrna, Georgia. I think it's Georgia. Nashville. Nice. Ashland. New York. Very fun. Wow. Redwood, Woodbury. It looks like most of us are from Louisville. And I know I'm probably not saying that right. I know you're supposed to say it a certain way, like Louisville. So forgive me if I'm saying that incorrectly. So thank you guys again. This is fun to see where everyone's from. For the next polling question, I'd like to know who here on our webinar tonight, what is your role in the office?
Plenty of folks typing answers into the chat bar as well. Val, they primarily hygienists in there. There's a dentist, an assistant or two, but primarily hygienists in the chat bar.
Yeah, so we can see 76% up on the screen here. Hygienists, 21% dentists. Thank you, office administrators, for being here. Some assistants for being here. It makes a team truly when we implement lasers into the practice. So great, nice to have you all here. So here's what we're going to do for the next 50 minutes here is we're just going to do a brief overview of the introduction to the science behind diode lasers. So why lasers? We'll talk about some of the clinical applications that we can do to help enhance our patients' care, and then some communication strategies that'll help you implement and get the case acceptance that you need in order to move forward with lasers in your practice. So currently, how many hygienists on this webinar tonight are currently using diode lasers? Wow, this is so close. We got about 50-50. I mean, it's really, wow, look at that. Very close. So about half of you have used lasers. The other half have not. And so I know for those of you who have not, again, this is going to be super, super helpful for you as you start your journey and learn more about how to be an Epic hygienist, laser hygienist. So those of you that are already with us today, again, you might have some questions. We're going to allow time at the end for Q&A. So definitely want to make sure that you stay on for that, and we'll have some interaction that way there. So here we go. Introduction to diode lasers. We know the term laser is an acronym for light amplification by stimulated emission of radiation. And the first application of lasers was all the way back in 1960. And this was the ruby laser as we know it from Dr. Mayman. So way back when in 1960, I know hygienists, I've been using lasers for 17 plus years now. And I know hygienists that have been using lasers 30 plus years. So it is not new to dentistry. However, I know it's still new to many of you, and it's really has started to take off, especially with what we're learning more and more as science has come out. We've, and especially what we've learned during COVID, about the aerosols and what we can do to help mitigate. So there's been more and more interest in diode lasers in the hygiene operatory. So we'll touch on that a little bit more. So just some basics, laser basics. So what do lasers do? Well, they produce light energy, and that could be absorbed by a target tissue. Okay, so that's what we want. We want that light energy that goes in, and we want it to target those diseased bacteria, those pigmented bacterias. The absorption process produces a thermal reaction in the tissue. It kills the bugs that we need it to kill, and it keeps that healthy tissue intact. The radiation that's involved in generating the laser light, it's non-ionizing. So it does not produce the same effects that we see with our X-rays, our X radiation. It's on a different line of the spectrum. So it's safe. There's no contraindications. We don't have to worry about, pediatric patients, nursing mothers, completely safe that we can use lasers in the practice. The light energy is, again, it's non-invasive, and it's a non-toxic alternative to pharmaceuticals that reduce inflammation, reduces pain, reduces bacteria, and then it stimulates the wound healing while leaving that healthy tissue intact. One of the things that I really love about diode lasers, again, is the science behind it, because of it just, again, that light energy and what it's doing. And it's almost like photosynthesis, where it's going through and it's creating this reaction, and it's allowing the good cells to do what they need to do while destroying the bad cells. So again, we see a lot going on with fibroblastic activity, osteoclast activity, healing, the wound healing that we'll talk more about. And specifically when we're looking for patients that are looking for alternatives to pain. Right. So we have some alternatives that we can do to help eliminate pain for our patients while promoting that healing during procedures. So again, all lasers work by delivering energy in the form of light. And when used for surgical and some dental other procedures, it acts as a cutting instrument. So as hygienists, that's not how we use lasers. That's something that our doctors will do. So they'll use it more of a surgical approach, where they can use it around crown troughing. They'll use it for biostimulation. They'll use it for gingivectomies, gingival contouring for their cosmetic cases. And then there's other lasers, hard tissue lasers that you'll get more of that on another course. But with the soft tissue diode lasers, our doctors can use it as a surgical instrument. As hygienists, we're not using it to that scope of practice. And so we're going to talk a little bit more about what we can do as hygienists in the realm of diode lasers. So what is the diode laser doing when we get that reaction, that light energy that goes into the tissue? Well, again, on that cellular structure, it's destroying the cell walls. It's going to alter the DNA, modify the metabolic process. It increases that ATP. If you guys, we're going to take it back to school if you remember that. And then it's going to unplug that polysaccharide structure of the biofilm. And biofilm is the big buzzword. We've known about biofilm for years, but with more and more research in the oral systemic health and what we're finding, it's the biofilm that we want to get after. And so this is why, again, diode lasers has taken such an interest into the field of hygiene and the practice of hygiene in dentistry. So our key objective with using diodes is to eliminate those periodontal pathogens through its antibacterial property and its anti-inflammatory effect. Okay. And again, we want to promote the healing of the periodontium and bring that back to a state of health. All right, so just looking at the spectrum here, here we are, there's many lasers on the market. And when we look over here, this is more of our ionizing radiation. So our X-rays would fall into this area on the light spectrum. When we look at diode lasers and some of our other lasers, our CO2, our erbium YAGs, they fall over here in the non-infrared. And so here you'll notice diodes. Diodes range anywhere from 810 to 1064. And so you can see there that we're in the near infrared. And so that's where it's safe. Other than the eyes, it's safe to use on our patients. But again, we will always still wear protective eyewear to protect our eyes. So again, I'm not going to go into physics. We're not going to go too deep into physics. As this being an introductory course, I just want to have you get an idea of what's happening with your diode laser. As you go through further training, you will go through much more specifics on that. But for today's webinar, let's talk about what's happening. So we know that in order that laser light to have 4 different types of opportunities of when that light leaves the handpiece. And so we want absorption, and that's what we're looking for. We're looking for the absorption of the laser light by that target tissue. That's our primary and our most beneficial effect, okay? That photon absorption in the tissue, in order for that to happen, we need to have a chromophore, which is color. And that's why diodes work so well with periodontal bacterias, our P. gingivalis, our AA, because of those pigmented bacteria, those red, those orange pigmented bad bacteria. So it specifically targets those. And that's why, again, diodes work so well in hygiene with our non-surgical perio procedures. Again, our aim is to increase that photon absorption by reducing its reflectance that you'll see here, the scattering, and the transmission. We want that absorption of the laser light to really go in and, again, leave the healthy tissue intact just by getting the bad bacteria that we have down into the sulcus. And then a couple other things that absorption is going to be dependent on, and that's going to be the water content of the tissue. And then, like I said, the chromophores, that tissue pigmentation. And then, of course, the laser wavelength. So you, as a dental professional, as a clinician, are probably saying, like, so what can I control? Where do I play a role as this being in my operatory? Is it safe? I get hygienists that ask me all the time, am I going to hurt the patient? Is it safe? And so, there's things that you can control. So no, you're not going to hurt a patient. And you stay within your parameters. And we'll go over what some of those are. But really, you control the power settings, right? So that you control the power settings that you're using here on your laser. You control the rate and the duration of the exposure. And what I mean by that is, how much time are you staying in the sulcus? And then what is your movement like? Right? So as hygienists, we're very familiar with Cavitron, our Cavitron tips. So if we didn't have that water, right, what will happen? And if we're not moving it at a certain level, we're just letting it sit there, it's going to heat up. And so you want to think of it in that respect too with our diode laser. We want that movement. We want to keep it cool. And, we definitely want to make sure that we are spending the time that we need to be in order to get the outcome that we're looking for. So again, although clinicians can control some of the factors that affect the laser tissue interaction, 2 factors still remain independent of the operator, and that's the unique characteristics of the wavelength, and then the qualities of the inherent with the specific target tissue. Again, those chromophores, pigmentation. If a patient's more melanin, you may want to bump it down versus someone who's got fibrotic, maybe our smokers that have that fibrotic tissue. There's times that we may need to bump it up to get the response that we're looking for. And then, of course, this says here, the contact versus non-contact mode. And so there's certain procedures that we're going to be in contact, and we're going to be using the laser fiber tip in the sulcus. And then there's going to be situations that we are making a procedure, we're using the laser in a non-contact mode. And that would be something like aphthous ulcers, herpetic lesions, denture sores, if we're going to use it for a TMJ, so other types of applications that we can use lasers for. So my one clinical tip for you today is you want to match the proper wavelength with chromophores present in the target tissue. And if that's one thing you can take away from me, then, that's something that's really important. And the reason that's important is because it's all dependent on the tissue. It's all dependent on our patients, right? No two patients are exactly the same. So again, what their tissue looks like, if it's edematous, red, puffy, swollen, versus fibrotic or, mild pink. So those types of different ranges in the tissue response, this is why we're always looking at the tissue when we're using our laser. And you'll match that wavelength based on the tissue that the target tissue for your patient. So can a dental hygienist use a laser? Another common question I get. And yes, while, a majority of our states allow us to use lasers, there are still a few lagging. We've got some laggers out there. I'm really proud of South Carolina. If anyone's here from South Carolina, you guys just recently got lasers approved by your state board. I know in other states that they're in rules and they're considering additional allowing lasers for hygienists. So there's still a few out there, but for the majority, they do have, they do allow hygienists to use lasers, but each state is going to be different. So it's really important that you contact your state dental board or your province, wherever you're from, and ask, what is the level of supervision? Is it general supervision, indirect supervision, direct supervision? Can you use can you curettage in your state? There are states that allow you to curettage and remove that necrosis tissue, the necrotic tissue, and there's other states where you cannot. So it's real important that you know these before you implement lasers into your practice. So it's as simple as giving your state board a call or Googling, going and looking at your statute. So go ahead and make sure that you guys take a look at that and know what's in your area. So this is really exciting. Now that we know that hygienists can use lasers, this hygiene laser here is called the Epic Hygiene. And this was the hygiene laser that was designed by hygienists for hygienists. And I feel really lucky to be sitting here today to tell you that, I was able to sit with our research and development at Biolase with a handful of other amazing hygienists who have years of laser experience and really provide feedback as to what we needed as clinicians. How did we need that handled, in order to produce less fatigue, right? How did we need the grip? Right. So they paid attention, and that's what I love. So the research and development team, they took our suggestions and they were able to roll out. And of course, we made it purple for the hygiene color. And so they really took all our recommendations and designed this beautiful laser that you see here, which is the Epic Hygiene. So a couple things here. The Epic Hygiene is, it comes with turn-by-turn clinical protocols that you guys can use. It'll have a guide. You can use this for pocket therapy, period debridement. Again, you can use it for your ulcers, herpetic lesions. And so there's training that comes with it. We have online training. So again, it's a great laser to look into. One of the things that I really love about it is we made it easy for our hygienists, right? So we've got these presets here based on the procedure that you're looking to perform for your patient. We were able to have these presets, and no, presets aren't everyone, right? Because we just talked about how our patients are different, but it is a baseline, right? So you can start here. This is a baseline. And then again, depending on that tissue type, you can either bump it up a little or bump it down a little bit by using these controls that go up and down. We keep it super simple and easy. And there's many different settings for the applications that are approved by this laser, for this laser. So why diode lasers, right? Why diode lasers for hygiene? Well, we know that the American Academy of Periodontology emphasizes that periodontal health should be achieved in the least and most invasive manner, cost-effective manner as well. And so again, when we look at antimicrobials, antibacterial, with resistance, our lasers do not provide any type of bacterial resistance. And so it is a minimally invasive way that we can provide our patients a higher standard of care and produce an outcome faster. Our patients will heal faster. They'll have less pain. So again, providing those benefits, non-surgical periotherapy to our patients by providing them state-of-the-art care. And this is something that we've all seen. We're not shy from the last year and a half. The more and more research comes out. This is early research that you can see here, even, when we started into this pandemic, when these studies were coming out and they were suggesting the link between gum disease and respiratory failure in COVID-19 patients. And we do know that there is a relation now. They've done studies now that showed, more patients were intubated that had periodontal disease, that had, COVID-19. So again, publication after publication on oral health and its relation to COVID-19, supporting that what we do every single day as oral healthcare professionals is so important. The mouth is connected to the body. We've known about the oral systemic link. We've talked about it to our patients, but thankfully patients are finally listening and they're getting it. Patients are now who haven't had periotherapy before, and they've been hanging on to their treatment plans and coming in saying, I just want a regular cleaning that my insurance pays for. I know you all have heard that before, right? We're able to educate them on the importance of the oral systemic link, and they're understanding, they're connecting those dots now, right? So they're finally getting it. So you have an opportunity. My colleagues here today, you have an opportunity to really showcase what we do so we can get our patients healthier in our practices. So why, again, use diode lasers in hygiene? Well, we know for sure there's less bacteria that's flowing into the bloodstream before any instrumentation. So we cut down on that viral and that bacterial load. Right. So one of the things that when I introduce diode lasers into my practices where patients have never been experienced it before, and maybe it's the first time, and we want to do a pre-procedural laser bacteria reduction, which has been very common through the COVID-19 pandemic here. And we want to introduce it to them. And it's just as simple as, hi, Mrs. Jones. It's great to see you again. I know it's been a while. One of the things that we've implemented during the pandemic, or since we saw you last time, is called a dental laser. And we're so excited about it because what we can do now is we can go ahead and we can decrease the bacteria in your mouth. So two things are going to happen. It's less bacteria going into your bloodstream when I do your cleaning today. And then it's also less bacteria that's going into the air. So it's keeping you healthier and me healthier and my team healthier. We're able to reduce and minimize the risk of aerosols in the air, right? So everyone knows about aerosols now. Our patients will appreciate that you've implemented this into their practice, and they'll want it every time they come in, and they'll see you as cutting edge. That you've made these changes into the practice for them to ensure their safety as well. So soft tissue lasers, they allow us dental hygienists to perform more procedures with more predictable outcomes. Again, we're healing faster. Today, diode lasers, again, as that pre-procedural, we want to reduce that incident of bacteremia and mitigate those risks for aerosols, which I discussed. So some additional benefits of diode lasers is decontamination to reduce the bacteria in the sulcus. We can prevent tissue inflammation, keeping our patients healthier between appointments. Okay. We can prevent further tissue destruction and breakdown. Treatment of gingival inflammation, our gingivitis therapy patients we can treat, and then also as laser-assisted periodontal therapy. So again, instead of maybe adding an antimicrobial or an antibiotic with our scaling and root planing, our non-surgical perio patients, laser is now an option that we can do that. It reduces biofilm, as I mentioned earlier, and stimulating that tissue healing and regeneration. Photobiomodulation. For those of you who are new, you're probably wondering what that is. It's also known as PBM. And what that means, basically, it's a low level light energy that we're able to create that biostimulation for healing, reducing pain. And so it's a great, we use it for herpetic lesions to treat the herpetic lesions. So again, great way that we can treat our patients to promote healing. It stimulates, that this is a big one. When we're going through and we're explaining, scaling and root planing to our patients, right? And we're letting them know what we're doing is we're cleaning the tooth surface, right? But now we're using light energy and it's going into the sulcates and penetrating into that tissue where we weren't getting that bacteria before. So what's going to happen? Not only are we destroying the bacteria, we're now stimulating fibroblasts, collagen, osteoblasts, bone forming cells. So we get better tissue attachment. And again, that faster healing that we're looking for to reduce those pockets and get our patients healthier. Improved healing, decreased discomfort, we already talked about. And then again, this is offering our patients the standard of care. This is an improved standard of care for our patients and it's optimal treatment. Setting yourself, as someone that's maybe more advanced in your area, my goal, and I know a goal of Biolase and one of their, from our CEO is to have a laser in every office, right? It should be the standard of care. So hopefully we'll get there one day. But for now, we're going to continue to just provide this education and hopefully we can spread the word of love for lasers. So for our dentists that are on today and hygienists, for your awareness, these are all the things that your dentist can do with a soft tissue laser. So of course, as hygienists, we don't do this. We're not doing fibroma removals. We're not doing gingival troughing or gingivectomies, frenectomies. But again, it's important that you know what your soft tissue lasers can do, because at a different setting, your doctors can perform these types of procedures. So just getting down to the applications in hygiene, as we talked about, laser bacteria reduction, laser-assisted periodontal therapy, aptus ulcers, herpetic lesions. We can help create hemostasis, reduce dental pain for our patients who have TMD, TMJ problems. We also have the ability with one of the lasers through Biolase, the Epic X, that we can do tooth whitening and desensitize our patients as well. So as implants continue to grow, and we see more of that market taking over a lot throughout dentistry, more and more patients are looking for implants to help them attain a better smile, chew, function. We're also seeing that there's a tsunami of implants that are failing. And so implant maintenance is very important. And so we can use our diode laser to help treat our in-between appointments to maintain our implants. If when you get down to implant mucositis, you definitely, or implantitis, you want to refer that out to your specialist. Okay. So it's definitely okay to, at a low level, use that heat for that mucositis where there's that red and inflamed tissue to kill the bacteria, where you see that redness and swelling, or like I said, in between appointments. But once you start seeing implantitis, there's maybe some changes in the bone, more infection, we definitely want to refer that out. Biolase has a great protocol, the perio repair. And so that's something that our doctors can look into, and they can assist treating our patients in that respect. So again, common terminology with lasers we see is LBR, laser bacteria reduction, LAPT, that's laser assisted periodontal therapy, and photobiomodulation. And that's that PBM, or like I said earlier, low level light therapy. So let's show you a picture or a video here. This is a video of patient receiving LVR. And you can see that the tip is only going about 0.5 to 1 millimeters into the sulcus. And so the laser fiber energy is going around. We stay at the long axis of the tooth. So we enter the sulcus, and again, shining that light energy into the pocket to reduce those bacteria. And here is where here's a video that I can share to where you can see where this is done with a patient that was coming in for periodontal therapy for scaling and root planing, and a periodontal debridement was performed. You can see here the hygienist is going from the distal to the mesial here, but she's got a I'm looking here at the video. She's actually getting some of that necrosis and that dead tissue out. Okay. So this is where they will use a different tip, an initiated tip, and doing more of that curettage procedure that you can see here. She's spending time here in the coal area, which, as you guys know, that's mostly our most infected areas, those interproximal areas where we've got those deeper pockets. And so the difference with LBR, is you're only going about 5 seconds per tooth, no longer than 5 minutes per the entire mouth, versus when we're using the laser on a different setting with our laser bacteria reduction and our LAPT. During scaling and root planing, we're now dealing with patients that have, deeper pockets, maybe furcation involvements. They've got granulation, necrotic tissue. So we will spend a little bit more time going to the base of that pocket, working our way up to remove that necrosis and that dead tissue while promoting healing. So again, we talked about herpetic lesions. And what's nice, we use the herpetic lesions at typically around anywhere from a 0.6 to a 0.8 watts. And it only takes a few minutes. And patients love it, because in the past, we used to, patient comes in, they have a herpetic lesion. What would we have to do? We'd have to refer them out. But today we can actually take care of our patients and provide a service to them, instead of sending them out to their physician to get a prescription for acyclovir, or to the drugstore and they spend $25 on a cream. It takes 2 weeks. Meanwhile, the vesicles get bigger. They're in a lot of pain. And so we can reduce all of that right away. It is amazing what we can do with our diode laser. The best time we can get it is in that prodromal stage. So let your patients know, if you have it on your medical history, do you frequently get herpetic lesions, or cold sores, right? If they check yes, great conversation to have with them. Mrs. Jones, did you know now that we have a laser here that can treat I can see here on your medical history that you often get, herpetic lesions. Did you know we now have a laser here that can treat that for you? The best time to get it, Mrs. Jones, is when you start feeling it coming on. Once you start getting that throbbing, just give us a call. We will fit you in. You might have to wait for a few minutes, but we'll definitely get you in. We want to take care of that for you so we can send our patient out the door and on their way. What's going to happen if we get that patient, even if the vesicles are just forming, it's going to go in there, it's going to dehydrate, get that virus, it's going to initiate that healing process. And so you're going to see just within 24 to 48 hours, already that patient's going to get healing. They're going to have crustation, it's going to start crusting over. Instead of turning into more vesicles, it's actually healing. And then that throbbing goes away. So now you are the hero, right? The hygiene heroes that you are. And so again, we'll use the laser here, a different non-contact mode, just above, circling around that herpetic lesion, crosshatch, going over that lesion, just a few minutes. The patient will feel a nice warmth, and that's what we're looking for, is that nice warmth. So you'll communicate with your patient during the process that you're doing this. And again, you guys will get this all in training, but it is one of the best procedures that that when we've implemented, that our patients appreciated it, because the more that they would have this done, So for example, there's some people that get it done every month. They would come in, all of a sudden they started seeing less and less times. There's even patients say, I haven't had one in years now. So it really is something that's life-changing for patients. Okay, and then we talked about pain therapy. So you can see here, here's the attachments that I noted earlier. This one you'll see here is for the whitening. This is our pain therapy attachment. Okay, and what we're doing is we're able to hold that along the area of the TMJ, the masseter, and various areas there. And what's going to do is it's going to stimulate the cellular function, proliferation, and motility. It activates that mitochondria. It releases that nitric oxide. Okay, it provides that vasodilation, so we get that blood flow. Helps increasing with that anti-inflammatory effect and promoting the wound healing. Reducing the pain, and really allowing the patient to get movement. They will get more movement. You'll see, they'll feel that reduction of that tension that we typically get with our clenchers or grinders. So again, allowing us to help our patients feel better and get healthier. Here's the one for the whitening that I mentioned, and Biolase has a whitening procedure. It only takes 20 minutes. For the total whitening portion of the procedure, we will still go ahead and use a rubber, the dam. You can use the dam that you'll put on to isolate, then put your gel on. Simple, easy. Such good feedback I get from so many hygienists, and our patients are getting a few shades lighter. Of course, it's always going to be dependent on the patient, right? So if they're a coffee drinker, smoker, wine, they have blueberry smoothies every day, whatever it may be, tetracycline stain. So the results that they're going to get with whitening is just like any other whitening, right? It depends on the patient where they are. But what we do know is this is going to jumpstart them. They're going to get a few shades lighter. And if they are those severe cases, we do have a take home that they can go home as well and finish, or another whitening that you can do to allow them to complete, or have them come back in a couple of days and do it again. It does not take very long to do. And it's another great added benefit service that we can provide for our patients. So here it is. We talked about, the Epic Hygiene, with it helping us with the aerosol-free mitigation, but it is indicated for use. Here's the things that we've indicated for use. It's received a FDA clearance in early 2020, which was perfect timing, by the way, for right before the pandemic. So it couldn't be better, but it is the only hygiene laser that has been FDA cleared for laser bacteria reduction. Okay. And then you can see here the other things that we've already talked about, the pocket therapy, which is that LBR, that we'll also do either pre-procedurally or therapeutically, the periodebridement, the curettage that we'll do during laser-assisted periodontal therapy when we're doing our SRP, hemostasis, and then our Optus ulcers. So that's what the indications of use are. So you're all wondering now, okay, learned a little bit about lasers as we've done this broad overview. So how do we incorporate this into the practice, right? So we know, as I mentioned earlier, LBR pre-procedurally, okay, pocket work, AKA pocket therapy, it can be incorporated with all our patients as that pre-procedural. Okay. The periodebridement is performed in addition to your scaling and root planning. So your non-surgical periodontal therapy that you're already doing in your practice, we can add that on as an additional service to the patient. But it's really important for us as clinicians, is start looking at the medical history, start connecting the dots, look and see, what if my patient's still coming in and they're having bleeding in between on their periodontal maintenance appointments. We should be seeing periodontal maintenance appointments, no bleeding, right? Because we should be maintaining health, not maintaining disease. So if they're coming in and we're seeing bleeding and pocketing, we're maintaining active disease. So we can incorporate the lasers even during our periodontal maintenance appointments, or if you re-enroll them into scaling, root planning, or active therapy, use it at that point, and then continue to use it during your maintenance, right? Always continue to keep our patients healthy in between appointments. In order for us to treat our patients periodontally, we have to do a comprehensive periodontal examination. And so I know that AAP in their guidelines once a year, what does that include? Well, guys, we need to be doing a complete perichart that includes our clinical attachment loss. Okay, so our recession, not just our pocket depths, but the bleeding on probing, furcation involvements. Is there separation? Is there mobility? look at their occlusion. What's going on that's causing this periodontal condition? What does that health history look like? Are patients diabetic, have cardiovascular disease? Is there something inflammatory going on? Autoimmune disease. So we can better co-diagnose for the periodontal problems that our patient have, and then provide laser therapy as a solution to their periodontal problem. Make sense? Educate our patients as well, that you guys have it in the practice. I mentioned that earlier, but now let your patients know that you'll have it in the practice. All right, so here's what the model of care, as we implement this into practices, here's the codes that I wanted to share with you that you'll use. So patient comes in, you're doing a 1110, which is your adult prophylaxis. Well, you can do laser bacteria reduction pre-procedurally, and that's what we'll do to reduce those aerosol mitigation and reduce bacteremia, okay? Another way that we can use the laser, a patient comes in, you notice puffy red tissue, no radiographic bone loss, so we know our patient's got gingivitis. So now we can use it, we'll still use our Cavitron, we'll still use our hand instrumentation to finalize any hard interproximal calculus or calculus that we may have missed with our Cavitron, and then provide the laser as a therapeutic solution for our patients before they leave the practice to reduce that inflammation, provide healing. And then with periodontal therapy, same thing. Still use your hand instrumentations. Nothing's going to change there. You're still going to use your Gracies, your right and left Cavitron tips, whatever you use, and then laser at the end of that appointment. And you can see here, so you'll add on the laser with your 4341s, your 4342s. And then, as I mentioned, periodontal maintenance, it's so important. Some people think that, the laser is a one-time shot, right? And it's not. Once you become a laser practice, you use your laser in every appointment. So if your patient is coming in for that perio maintenance, it's a part of the perio maintenance program, right? Again, we want to keep those patients healthier between appointments. And we can do that with lasers. You're gonna be amazed once you see over time when you're actually getting patients in the chair and you're like, wow, they didn't have any bleeding, and their perio maintenance was so much easier this time. As hygienists, we're constantly in this mode of leaving and cleaning and always working hard on our patients. So it's nice when we actually get those easier type of appointments, right? So you'll notice we're not always treating active disease. You are going to get your patients to a level of health, and then you're going to be able to maintain that health. So with training and implementation, it's real important. Laser safety, we can't stress laser safety enough, right? So there's certain things that we need to do with laser safety. One thing is, there's specific glasses that you've got to wear that matches the laser wavelength. Okay, you got to use a 0.1 micron filtration class 3 mask. Many of us didn't even know what a class 3 mask or an N95 was prior to COVID. We all know what that is now. And with lasers, even 17 years ago, we were always using a class 3 or an N95 mask. Okay, so you guys, you have those in your practices now. That's what you'll want to use when you use your laser, as well as a high evacuation system. With the pandemic, that's another thing, the silver lining it brought us. There's so many options now with what we can do for hands-free. Aerosol Sys is amazing. They came out with a hands-free that you put your slow suction in. You're able to set it here. It's comfortable for the patient. Now we have our hands. We can use our laser. The high vac's going. It's catching all the any potential aerosols, and we've got our high vac going. You want to have your signage up, your laser safety signage. Always know what your surrounding areas are. Everyone has to wear their glasses within a certain feet distance, depending on your laser manufacturer. You have to go through LSO training. So somebody in your office needs to become a laser safety officer. And so when you go on and do your training to implement lasers into your practice, this is the type of training. You're going to be going over all these types of modules or objectives, I should say, that you'll be able to go through to get you prepared and get your team prepared to implement lasers into your practice. Okay, they'll go over documentation, charting, infection control, in addition, what parameters for what types of procedures. Definitely go more in depth with that. Okay, so always laser safety. For everyone on the phone or on the webinar today, check out our events on Biolase. So you can go to www.biolase.com. There are live events that Biolase offers. There's even virtual online events. So there's an 8-hour online module. We have regional trainings. Many of our faculty educators teach throughout the country, so we can connect you with one of our partners in education. So if you need anything, reach out, put your email maybe in the chat box if you need anything, and we'll help you continue to seek out additional training and education. Here's an example of one of the virtual hands-on diode trainings that Biolase offers. And again, you can find this on the website, but it is designed for hygienists that provides, again, that foundational training around physics, safety, laser fundamentals, all for the diode systems that we have, the Epic X, the Epic H, okay? And so maintenance, care, specific procedures, and then there's an actual virtual hands-on that we'll have, that you will send out a kit, and you can do that as well. So again, you'll have online modules. That's a prerequisite that we recommend before you take that virtual and we do the hands-on, but you can find all this information on biolase.com. Very excited here to talk about the Epic Hygiene Academy. We just released this within the last, I think it was a week and a half, David, I'm not sure. Very, very new. It's called the Epic Hygiene Academy. And this is going to allow, again, industry experts. We've got educators, KOLs, our Hygiene Academy clinicians, live, available in a forum, virtual group trainings, for you to help you evolve as you become a Epic hygienist. So we want you to be able to get on-demand access when you need it, but also reach out to hygiene experts when you need additional support. And this is what it is. It's a support community for you. So I invite you to join the community by going to biolase.com/EH and go ahead and sign up. And as we continue to grow our Hygiene Academy, we definitely want you to be a part of our community. And we know it's going to take the entire team, right? So it takes the entire team in order to implement dentistry. And so I'm glad to see we've got doctors on, for our administrative staff on, and our assistants on. So go through training as a team, practice as a team. There'll be codes, do treatment planning, how to treatment plan, how to have those chairside conversations, how to do those handoffs. Going to be all important as you implement lasers. And for the doctors on, you're wondering, gosh, what is the ROI for my hygienist, right? So you can see here, lasers pay for themselves. Okay, they pay for themselves. Just some people pay for them in 2 weeks, some people pay for them in a month. But as you can see here, even just with 8 patients a day, 5 patients a week. Now, let's say our perio patients that we're seeing, only about half of them say, yes, I'm going to go ahead and schedule for that scaling and route planning. Okay, doctor, that's still potential annual revenue of $48,000. Okay, now if you have a higher case acceptance rate at 80% of your patients say yes to your scaling and route planning procedures, now we're looking at about $76,000 added to your revenue just by implementing laser therapy into your practice. Okay, and that doesn't include your LBR. That doesn't include your herpetic lesion, aptus ulcers that you can charge for. So again, great way that you guys can implement into laser and still be profitable and provide the best care for your patients. So what do we do now? Well, the first step is to reach out to your territory managers, get trained, go online, learn more, and really, the next thing is then implement lasers into your practice, right? And become that Epic hygienist. So I'm super excited to hear from you. We're going to go ahead and open it up to answer some questions now. This is my contact information. If you guys need anything, you can scan the QR code and reach out to me, or my email is here, but we do want to open it up for questions as well.
Yeah, thanks so much, Valerie, and thanks for an engaging presentation. There's a lot of great information. I think we'll reinforce that this is an initiation to diode lasers, and that there's plenty either within Biolase or outside of it. Places like ALD and some programs in the country that you can seek out support. We're certainly happy to help you get started, and hope your interest manifests into a deeper dive into the educational side of this. Now, having said that, there are some questions here. These types of questions I think would be very easily resolved or at least answered on that Epic Hygiene Academy. So please, if you have an interest, jump over to that page and sign up. There'll be more outreach from that in the next couple of weeks. This question, Valerie, is from Irina Kondra, and I apologize if I'm saying your name incorrectly, Irina. What do you use for laser eye protection when you're wearing loupes?
Oh, great question. So there are inserts. There's several different types of manufacturers that make inserts for your loupes. So you can actually insert them in. And there are also manufacturers that'll make certain lasers, safety goggles, big enough that you can not necessarily wear over, but if you do wear glasses, you can wear them over your glasses. But for loupes, typically you need to get the inserts and they just pop in. They pop in on the inside.
Great. In fact, we offer some of those at the courses for people to try out. So I think it's a matter of personal preference typically.
Yep.
Also from Marina. So it looks like she might have 3 questions in there. So we'll see how we do with her here. We don't want to let her, see if we can group them together here a little bit. What certification is needed for practicing the laser? I know you talked about this, Val, but the question is online certificate enough? I think, the information you shared about every state is different is super important, but maybe you know that some states do need that and not. Can you give a general answer, or would you prefer to go back to your, check to your dental boards?
Yeah, what does that look like? So, there are, the ALD has done a good job at creating, what that certification process looks like. They help do that. But not every state is going to require you to do that. Some require, that you've just been trained. It doesn't say where. Some say you have to be in at a university or school. Some say you have to have 12 hours. Some don't say, so some are gray. So again, going back to checking with your state boards. However, I do say go to a trainer. Because that hands-on is you want to have some sort of hands-on and get feedback from somebody who has been using lasers and can help guide you. That was the best thing I did. My doctor, when he invested in me, we actually brought a trainer into the practice and they did over-the-shoulder coaching. And I'll tell you, because I was nervous coming back. I remember when I was a baby hygienist 17, 18 years ago and learning the laser, and I wasn't confident enough, and she helped me really gain that confidence. So seek out education for sure.
That's great. Switching to Ronald Shimizu, what code can be used to submit to insurance companies for LBR? And before you answer that, Val, I'd like to tell everyone that we do have a laser billing and coding seminar coming up on December the 1st. I'll give you some information at the end. It's an hour deep dive with an expert, Teresa Duncan. It doesn't mean that Val isn't up to speed on the clinical aspects of this, but we do have a chance for you to kind of dive in with someone that really does this as her business every day. And I think there's some great support coming just a few weeks from now, but please go ahead, Val.
Yeah, and Teresa Duncan is, she's known as one of the best when it comes to coding. So if anything, not just for this question, but she'll cover some other things for you as well. Very, very nice that Biolase is offering that webinar. So let's see, I think the question was for LBR. What was the code? Mm-hmm. Right. So to date, there is no specific code. Okay. So most offices are doing like a D4999, which is a miscellaneous code. You incorporate that when you're doing your scaling and route planning, or if you're doing the LBR pre-procedurally or therapeutically. So you'll use a miscellaneous code. There are codes, however, for, I don't know if you remember when I go back to that slide for herpetic lesions, doctors, if you're using a soft tissue laser, your gingivectomies, things like that. So again, you can get more about the coding. There's a code for PBM. I know because I'm the one who gave testimony on it at ADA in 2019. That's now in our CDT manual. So we do have a code now to treat for the TMJ and the pain. So there is a code for that.
Terrific. Moving on, I think we can sneak in a few more. This is from Diana Smith. LAPT is initiated with the tip in the sulcus, correct?
So LAPT means laser assisted periodontal therapy, and that's an intra-laser community inter-office, we'll say, communication, right? LAPT doesn't necessarily mean that you're using an initiated tip. When you're using an initiated tip, you're using an initiated tip, and you're doing a procedure called curettage. So that we know is the procedure. Right? The procedure, LAPT means it's laser assisted during your periotherapy. Now, are you curettaging with an initiated tip? Yes, that would be curettage. Or are you using a non-initiated tip? right? Because there's some states you're not allowed to curettage. In those cases, you would use a non-initiated tip, but still go in and treat those periodontal pockets.
Okay, great. These are a bit similar, so I'm going to group them together. One version of it is, do most offices add 10 minutes to an appointment because of LBR, or should more time be added onto the patient visit for using a laser? So kind of similar questions there, Val.
You know, when we start learning anything, you know, it takes us more time, right? But once you get comfortable, we never added more time. We were able to get it done in the time that was allowed. And like I said, if you're diagnosing the patients, if you're helping your doctors co-diagnose, if you're setting your patient up for what they really need, you know, they're coming back. You could be starting your perio therapy that day, but usually they're coming back, and you could add a little bit more time to that appointment as you learn. Yeah.
Excellent. So there's some very detailed questions from Kevin Lamb. And Kevin, I might just ask, please send us an email. You'll see an alias for the education department. Those questions really wouldn't be done justice in just 30 or 45 seconds here. So Kevin, they're great questions and we'll get you the answers to them. Please just use education@biolase.com and forward those in. And Valerie or one of our hygiene faculty will respond to you. From Nita Akabari, maybe the last one or second to last one. Do patients get sensitive when you use the laser for whitening?
So like any whitening, you know, hydrogen peroxide is hydrogen peroxide. And so that they could be sensitive depending on, you know, what is their enamel contour? What is, they may already be sensitive just with air, right? So that, you know, again, that's patient dependent. I wouldn't say that they're more sensitive, because that's one of the things that the light energy does, is it activates the hydrogen peroxide cells to work faster. But it's also helps depolarize that nerve, right? So it helps with desensitizing. So it's actually a benefit to the patients to use the laser whitening.
Great. Similar question on whitening, and we'll call it there. From Casey Cooper, I have heard whitening with the laser can make the teeth more matte and less shiny. Have you found this to be true in your experience?
I haven't, but I can tell you what, when we see that matte look, that means dehydration when it comes to whitening. So that matte look is typically because the teeth are dehydrated. Versus that gloss look. So a lot of times what you'll do is, you know, there's syringes out there that you can get with ACP and Morpheus calcium phosphate gel, and you can send them home with that in a tray or just put some on. But really it's about hydrating the teeth.
Okay, great. I think that's all we have time for this evening. Thank you. There were a couple more questions about out-of-pocket price or fees, recommended fees, et cetera. I would highly recommend, it's actually December 1st, not quite 2 weeks away, as quickly as this year is ending, where you can take those questions directly to Teresa. She has fee ranges, et cetera, how to bill and code, what narratives are important, et cetera, et cetera. So I do highly recommend, as Val's an expert at clinical hygiene, I'd like to direct you to Teresa Duncan, who's an expert at billing and coding. Okay.